Hello, welcome to the Cannabis Investor channel. My name is Jenna Sobocan, and our guest today is Timothy Ko, CEO of Entheon Biomedical. Hi, Timothy. How's it going?
Good. It's busy, but busy is good, so it's very good.
Awesome. Let's get started. Can you give me a quick pitch on the company? If you only had 30 seconds, how would you describe Entheon Biomedical?
I'm a long-winded person, but Entheon Biomedical is developing transformational drug therapies using psychedelics to treat a totally massively underserviced population that is substance use disorder sufferers using the transformational power of psychedelics. But doing so in such a way that is clinically rigorous, ultimately leading to hopefully full market authorization by various regulatory bodies.
Right, awesome. Thanks for the introduction. Why did you get into the psychedelic medicine industry, and what made you choose the addiction market to target?
Yeah, so great question. Part of the reason why I got into psychedelic, the sector is from firsthand experience witnessing my brother succumb to addiction. I lost my
Okay.
brother to addiction in 2019. He was a longtime drug user and substance use disorder sufferer. And over the course of about 20 years, it was watching every failed intervention be tried. And we spent
Right.
probably hundreds of thousands of dollars. And it never really amounted to much, thousands of hours with therapists, every medication known to man, Suboxone, methadone, antidepressants, anxiolytics, antipsychotics, all sorts of different treatment methodologies, but it ultimately didn't relieve him of that sort of internal tension that the behavior stemmed from. And so after I lost my brother, I personally had quite a few transformational experiences from psychedelics. I grew up in the same household that built my brother, and so of course I had some issues to work through. And I too tried the traditional route of psychotherapy and EMDR and different cognitive behavioral interventions, but
Yeah, for sure.
ultimately it didn't really do much for me either. And I actually found myself in a very traumatically activated place. And DMT was actually instrumental in changing my life. It really helped me to totally reframe who I was, what was important to me, what I wanted to leave in the past. It's very complex and I experienced a lot of things, but in essence, it helped me to really get a new perspective on my life. And so, knowing those two things to be true, that there's this transformational power as well as an absolute unmet need, I made it my mission to find the scientists and the smartest people in the world to affirm the idea that, yes, psychedelics could help. But then going beyond that, from, just beyond validation to how do we actually help people? Helping that, they help to inform the idea that, hey, this is a medical condition that can, ultimately take the lives of many. We need to fit this within a medical context so that doctors can feel safe in prescribing it and patients could feel safe in receiving it. So that's the work that we're doing. So using DMT to, create a medical product that will hopefully save thousands, if not millions of lives.
Right. Wow. Yeah, that was a great reason. What can investors expect from Entheon over the next 6 to 12 months after going public?
Yeah, totally. We recently made some really what we think super valuable acquisitions and partnerships. We understand that, of course, our within the 12-month time frame, we'll have the start of our clinical trial in the Netherlands. That's with a world-renowned contract research organization using GMP drug supply provided by our Canadian partner. So they have that to look forward to, the commencement of that study. And that study is super comprehensive, looking at more than just safety and pharmacokinetics, but also looking at a variety of other biomarkers that will further inform what constitutes a safe drug experience. But beyond that, as I mentioned, we recently acquired a company called Halogen. Halogen is focused on
Okay.
genetic pre-screening. And yeah, there's still a lot of mystery as to what makes a person, what constitutes an individual's mental health. Is it,
Right.
what part nurture versus what part nature, and how do you characterize that? And so for us, it's really important that we look at the genetics component, what makes a person susceptible to a variety of reactions. And so we have a product that's going to be launching within the next couple of months that will be commercially available so that individual users could understand what their risk factors are. So that's something to look
Wow.
forward to. But outside of that, the data that's generated from that will be sort of within this data project that we have that looks to compile across a variety of data signals. And so our recent partnership with Divergence Neurotechnologies, that's hugely of huge potential to us. We see that EEG is the technology that they use as being a foundation for way better characterizing individual patient variants, as well as understanding what constitutes psychedelic experience. And from that information, we get to analyze, what is safe, what is not safe, and how can doctors use the genetics information as well as the EEG information to better inform their prescription choices. And so you can expect some developments out of that to start to validate that technology and structuring some research that will be super useful to not only our own clinical development, but we think potentially servicing the entire psychedelic industry. Anyone that's looking to prescribe these medicines to people, we want to give them the best tools so they can make the best decisions that are ultimately in alignment with providing safe patient care.
Amazing. I appreciate you providing that information. I noticed you have a pretty big management team as well as advisory board with some notable names. Can you give us some insight into the strategy here and maybe mention some significant names for those who aren't familiar?
Totally. It takes a village to raise a drug development company. So we wanted, it to be a collective effort. And of course, this type of work in biotech requires a lot of specific expertise, and we're really excited to be working on a few other team additions that will be publicized soon. But yeah, our team is comprised of a variety of researchers, business people, etc. But really importantly, I think on our core operations team, Dr. Andrew Hegley is a super well versed in preclinical work and has been involved in a whole bunch of different drug discovery ventures, and not wanting to spend too much time on it. Our scientific advisory board, I think you mentioned, is full of some of the most prominent names in psychedelic research. Robin Card Harris from Imperial College of London, Matthew Johnson from Johns Hopkins University, as well as Malin Utog and Christopher Timmerman from Imperial College of London, as well as Dennis McKenna, and of course Kenneth Tupper and Michael Walker from Canada. But yeah, those really high profile names, like, we love to have them associated with us, but more than just being these sort of titular appointments or figureheads, they have been really informative in terms of affirming and validating some of our base presumptions and going beyond that to the point of, giving us a really nuanced and detailed approach to, hey, what molecule should we use? How long should we use it for? And what is a method of administration that is best suited to, tolerable therapeutic use of psychedelics, as well as associated therapeutics? Because, there is a lot of nuance to this approach, and we're lucky to have some of the most experienced people with the sort of longest track record informing that.
Wow, yeah, sounds like a well-rounded team. Entheon announced it has entered into a clinical study agreement with the contract research organization Center of Human Drug Research to conduct an early phase human clinical trial with DMT. What are you hoping to gain from this study? Yeah,
and so like I mentioned, it is a regulatory requirement that we follow. We have these assumptions about a drug, and we know from a literature perspective as well as anecdotal evidence that our presumptions are presumably safe and presumably true. But in order for us to eventually convince regulators, we need to do it in a form factor that is, produces very clean data, that is empirically, almost infallible. And so, of course, we're going to get the very basic pharmacokinetics, pharmacodynamics, understanding the safety of this. But in addition to that, we're looking at a variety of additional data fields that go beyond the scope of just proving out safety as well as efficacy, but looking at, what are the variations and variables that might affect a psychedelic experience, and looking at it from the perspective of how, from a biometric perspective, can you track this very mysterious thing called immersion into a psychedelic experience. So we're looking at a variety of other biomarkers that would indicate, different measures of how deep a person is in that psychedelic experience. And so, we are positioning ourselves to be, data focused in terms of how we develop our drug programs. And so we're getting a head start with including these additional fields of data into our clinical trial.
Interesting. Thank you for giving me that insight. Investors really like the right share structure on Entheon. Can you give us a rundown of the cap table and if there's any sizable lockups expected to hit the market anytime soon?
Yeah, at present we're about 52 million shares, 55 million fully diluted-ish. And yeah, we've always prided ourselves on having a very tight capital structure or tight share structure. From the perspective of, shares coming onto the market or lockups coming up soon, we recently did a raise in December. We raised about $3 million at 75 cents. And so that lockup is expected to come free trading in the end of April or thereabouts. That there is that to look at. But yeah, from our perspective, the quality of our investor base really does give us quite a sense of security in that, it is very tightly held and among friendlies.
Well, that's good to know. How can investors get involved and where can they find out more information?
Yeah, we invite everyone to visit our website, entheonbiomedical.com. I know that some people might have trouble spelling that, but that's ENTHEON biomedical.com. And we really encourage everyone to sign up for our newsletter. We have a ton of exciting developments and announcements that we're working on. It is a complex space, and so we want to have everyone get socialized to the ideas of what we're doing because it does involve a lot of things from the regulatory to the commercial to the clinical. There's a large sort of confluence of things. So the sooner that investors and interested parties understand that, they'll see the value of some of the efforts that we're working on because we really do think we're creating something that is, phenomenally valuable and serves the patient and the investor equally.
Fantastic. Well, thank you so much, Timothy, for taking the time to sit down with me for this short interview today. It was nice talking with you here on the Cannabis Investor channel.
Wonderful. Thank you for having me, Jenna.